let's talk more about this duality between holistic practices like yoga and Western medicine, because this is something that I think a lot of people are contending with now, with access to information, with, let's call it, the commercialization of yoga in the Western world, however you want to describe it. I mean, it's more available to people, which is great. Yoga is often misunderstood as just a physical movement, right? The asanas, a lot of people just think about that. It means union. It's a much broader system. It's designed to unite the body, the mind, the breath, your emotional health, your physical health, your spiritual health, all these things. Or at least that's what it does for you, in my view. Now, it does things to the body biologically, of course. It helps regulate the nervous system. It builds awareness. It addresses inflammation, as you said. At the same time, Western medicine excels at things like diagnostics and acute intervention. But these approaches don't need to be in conflict, right? Back when I trained as a physician in the UK, especially in primary care, we were always told when you see a patient, you take a history, you examine them, you make a diagnosis, maybe you send up for some investigations like blood work or whatever, then you have a management plan for them. Within that management plan, maybe this is just how it worked in the UK at least, there was always a layer of you should try holistic practices to support your health or disease journey. There may not be as much traditional evidence for whether or not they're effective, but they are low risk. And we know anecdotally that they help people. So give it a try. That was the approach we had. How do you think about the role of yoga in the modern health journey with that in mind, with this concept of Western medicine in mind? And what does it look like when you combine the two?
Well, first of all, I'm not a doctor and I'm not an expert on the American medical system, but I can pretty confidently tell you, in my opinion, they are not taught to offer any holistic approaches at all. I think America has been incredibly behind. In my opinion, I think there was a century in this country of an over-worshiping of doctors. I think doctors had way too much power, way too much control, and there was an arrogance there, which was the end result of that failed people like me so dramatically. The arrogance of this guy to have never x-rayed me again after 3 months of such unbelievable pain. How does a seventh grader or eighth grader have the discipline to fake this much? It defies logic to limp that long. I mean, I guess it could happen. So I'm telling you, to this day, I don't have a solution for all of the healthcare issues. It's overwhelming. I think what the Affordable Care Act did was some really positive things in terms of prioritizing preventive care. Of course, it's smart for women to have mammograms. It is far cheaper to pay for a mammogram than someone to go through breast cancer. It is so much better to stay in front of all of these things, to intervene earlier. So I understand the concept, but I'm always, because as a business person, I'm always looking at what's going on. The problem is, especially if you are someone like me, quite honestly, who presents so healthy, it is hard to even get care. It is comical. What I went through, I had a stomach problem for 2 years. I could not get someone to take me seriously. I was going to tell you 2 other stories. I had terrible bronchitis in my 20s. I'm pretty sure I got whooping cough when I was in my early 20s. I could tell you why, but I had horrific bronchitis. And then about twice a year in my 20s, I got bronchitis about every April and around every November. Terrible. Not as bad as that first one. I think I had a weakness, right? And then you take drugs and you, etc. The yoga got rid of that. I've never really had that since, or in a very way less way. These are specific things that the yoga was really good to strengthen my lungs and kind of become more hardy in that way. But I never really had in my adult life. I own my own business, so I never have great insurance. But I just really had a gynecologist. I believe you go once a year, you take care of your female health, I have babies, you get blood work done. But I didn't even have a regular doctor, because what do I need a regular doctor for? When I had a little knee thing that was funny, I went to an orthopedic. But when I went and finally got a doctor and said, I'm having some stomach problems, like they just wanted to refer me out to a million people. Like, all you have to do all day is go to these doctors. We know to get even a doctor's appointment can take 6 months. To find a doctor, even in your plan, who'll even take new. I mean, it's a joke. I ended up going to a holistic guy. And that's where I was able to, I actually had a real stomach problem. And I had to take a poop test and pay $450. It was the best money I ever spent. That's what I think is so frustrating. And even when I finally got to a gastro, it's like, well, I've seen you had your colonoscopy. They don't want to talk to you. I had a real stomach problem that I was able to solve with my functional doctor. But that I couldn't get help was unbelievable.
What's really interesting is when you talk to a lot of people in their 20s, 30s, 40s in particular, even up to 50s, if they're in good health, and if it's a female who has not had children, for example, or a male, and you ask them, what was the last doctor you saw? Or when was the last time you saw a doctor? They'll say, oh, my pediatrician. The way we approach human health in adults as they grow older, and even children, is you don't see anyone in a uniform sense until something has gone wrong. And everything that exists outside of that, what used to be primary care, which has now changed quite a bit,